Up to 80% of the world's healthcare is provided by nurses and midwives. In the developing world, they are often a patient's only hope. It is the nurses and midwives who are often at the sharp end. Less fated than their glamorous doctor counterparts, paid a pittance, yet no less committed. They are the front line in the global health crisis. This is Mongu in western Zambia, and our nurse on the front line is 48-year-old Inonge Mutenwa. Inonge is quite literally living proof of the effectiveness of antiretroviral drugs. She was diagnosed 5 years ago as HIV positive. For Inonge, like many others, the day starts ordinarily enough with breakfast in the company of her daughter Nasiku and her 3-year-old granddaughter. But comparisons with most nurses' lives, especially those in the more affluent nations, ends here. It's not just that Inonge must battle the infection. At work, she must cope with the overcrowded and unhygienic wards, for Zambia's health service is in a crisis as severe as anywhere on this continent. The root of the crisis is the HIV/AIDS pandemic, infecting, according to the Zambian Health Ministry, over 1.5 million Zambians out of a population of 10 million. And at this time of crisis, the rich countries are recruiting the most qualified Zambian nurses. The UK is the #1 destination. The Zambian Nursing Council reports that 3,500 nurses have left to work abroad in the last 12 years.
We have lost many nurses, what we call brain drain from the hospital. And most of these nurses have gone to developed world, like the UK itself.
The human resource crisis in Zambia has reached alarming levels in that most of our health centers in the country are operating at less than 50% capacity in terms of staff in almost all the categories.
In this program, we find out why so many decide to leave. But through Inonge, the nurse who stayed, see a little of what it takes to be a nurse in the front line against the pandemic. Inonge is leaving for Lewanika Hospital. There's no transport for nurses here in one of the most deprived pockets of southern Africa, so it's hard walk either side of her working day. Lewanika Hospital was built in colonial times in the 1950s and has barely changed since. In that forgotten time, before AIDS, there were once over 200 nurses walking these corridors. There are now just over 50. Inonge is starting her morning at the HIV clinic, where she works as a counsellor. And this is Moena. She's 16 years old. She's one of 14 patients Inonge has today that have come to be tested for the HIV virus. During counselling, Inonge explains the importance of using a condom. 80% of all HIV infections are as the result of having unprotected sex.
She has just come voluntarily to know her HIV status because she has been sick for quite some time. And now I was interviewing her and she has agreed. She's very happy. She wants to know her status. I collected the blood. I'm going to test her and I'll tell her the result.